Let's be honest, navigating healthcare can be a real headache. But what if getting your hormonal contraception was as simple as a trip to your local pharmacy? Well, in Queensland, a new service is making that happen, and it's a pretty big deal. It's all about making access easier for you and taking a bit of pressure off those super busy GP clinics. So let's dive in and see exactly how it all works.
You know that feeling, right? That little bit of panic when you look at your pill pocket and realize you're on the last week, you don't have a new script, and getting a doctor's appointment anytime soon feels impossible. It's so stressful. Well, this new pharmacy service is designed to be a safe, accessible solution to that exact problem. And look, this isn't just some casual thing pharmacists are doing. Queensland Health has put together a really detailed clinical guideline, basically a clear roadmap for both you and your pharmacist. It breaks down the entire journey from that first chat about your health history all the way through to your regular checkups, making sure every single step is safe and thorough. Okay, so to get our heads around it, we're going to walk through this whole process together. We'll start with what this service actually is, then we'll cover what to expect in your consultation, what your options are, the really important safety checks they have in place, and finally, what happens after you've made your choice. First things first, what exactly is this service? And more importantly, is it for you? Let's break down the basics. At its heart, the Hormonal Contraception Service gives specially trained pharmacists the ability to do way more than just hand you a box. They can actually sit down with you for a proper consultation, figure out your needs, and then prescribe certain hormonal contraceptives right then and there. So who can use this? Well, it's for female patients who are 16 or older. But here's the really crucial part. You have to have a full consultation every single time. Yep, even if you're just getting a repeat of a pill you've been on for years. This is all about making absolutely sure it's still the safest and best option for you right now. So you've decided to go for it. What actually happens when you're in that private consultation room? Let's take a look at how the pharmacist builds a complete picture of your health. The chat will kick off with a snapshot of your general health. Your pharmacist will ask about your age, any medical conditions you have, like, for example, if you get migraines with ARA, because that can rule out certain types of contraception, and they'll also check what other medications you're taking, any allergies, and your smoking status. It's all about building that safety baseline. The consultation also gets into a confidential and, sensitive discussion about your life context. This covers your sexual health history, like STI screening, but just as important, it creates a safe space to talk about any concerns around reproductive coercion or violence. Pharmacists are trained to be a supportive first point of contact and can refer you to other services if you need them. Now, it's not just a chat. There are a few simple, mandatory health checks, too. Your blood pressure will be taken, since high BP can affect which contraception is suitable for you. They'll calculate your BMI, and of course, the pharmacist will need to reasonably rule out pregnancy before prescribing anything. Okay, once the assessment is done, it's time to talk options. So what can a pharmacist actually prescribe through this service? There are 4 main types available. You've got 2 kinds of daily pills, the combined oral pill, or COC, and the progestogen-only pill, which you might know as the POP, or mini pill. Then there's the combined hormonal vaginal ring, which you just insert for 3 weeks at a time. And finally, the DMPA injection, a progestogen-only shot you get every 12 weeks. The best choice is totally different for everyone. It's a shared decision that you make with the pharmacist. You'll weigh up everything from your medical history and your lifestyle to things like cost and just how easy you'd find a particular method to use every day. The absolute foundation of this entire service is safety. So, what happens if your situation is a little more complex? The system has these really clear referral pathways built right in. In some situations, like unexplained bleeding or if there's a chance you're pregnant, the pharmacist will immediately refer you to a doctor. In other cases, say if your BMI is over 35 or you're at risk of an STI, the pharmacist might be able to help you out, but they'll also refer you to a doctor for ongoing care. It's a fantastic safety net. You might have heard that term UKMEC on the last slide and wondered what on earth it is. It sounds super technical, right? But it's actually just a national safety checklist. Health professionals use it to cross-reference your personal health history against all the different contraceptive methods to spot any risks. It's all about making sure the choice is medically safe for you. The guidelines also make sure care is tailored and respectful for everyone. For young people aged 16 and 17, their ability to consent for themselves is respected. For trans and non-binary people, the same safety checks apply, and there's an option for referral to specialists if that's preferred.
And providing a culturally safe service is a huge priority for Aboriginal and Torres Strait Islander people.
And this is exactly why that focus on culturally safe care is so important. The guideline itself points out that shame can be a massive barrier that stops people from seeking care. By understanding this, pharmacists can work to create an environment that feels welcoming, supportive, and safe for everyone. All right, so you've had the consultation, you've talked it through, and you've made a choice. What's the plan moving forward? You definitely won't just be handed a box and sent on your way. You'll get a full rundown on exactly how to use your chosen method, including really important stuff like what to do if you miss a pill. As long as you give your consent, the plan gets shared with your GP to keep everyone in the loop, and you'll leave knowing exactly when you need to come back for a checkup. And this timeline here shows you that long-term care plan. If you're starting a new method, you'll have a follow-up in about 3 to 4 months. For everyone, there's an annual review that includes a blood pressure check. And for those using the DMPA injection, a review with a doctor is recommended every 2 years just to stay on top of things. So when you boil it all down, this whole thing is about providing care that is informed, accessible, and above all, safe. It's not just about convenience. It's about improving healthcare for everyone by bringing an essential service closer to home, right into your local community.
This service really puts a health expert right within your reach. So now that we've walked through the whole roadmap, the last question is for you. What's one question this explainer has made you want to ask your own pharmacist?